Hi, my name is Joanne. In this presentation, I will be discussing two common musculoskeletal problems, rheumatoid arthritis and fibromyalgia. Rheumatoid arthritis is a chronic systemic autoimmune disease that is characterized by inflammation of connective tissue in the synovial joints. It affects several joints and the surrounding muscles, tendons, and ligaments. Its exact cause is unknown, but it likely results from a combination of genetics and environmental triggers. The most widely accepted theory states that it is an autoimmune cause in which rheumatoid factors form antibody complexes in the synovial joint, which then attracts neutrophils into the joint and cause inflammation and destruction of the synovial joint tissues. There are several diagnostic tests available to help diagnose rheumatoid arthritis. But first, a history and physical examination is necessary to determine family history and symptoms, and also check the joints for redness, swelling, and warmth, and to check reflexes and muscle strength. The healthcare provider may then order laboratory and imaging tests to confirm diagnosis of rheumatoid arthritis. Laboratory tests may include checking the erythrocyte sedimentation rate, C-reactive protein level, rheumatoid factor, and anticyclic citrullinated peptide antibodies. Imaging tests may include X-rays, bone scans, MRI, or ultrasound. Nonspecific clinical manifestations of rheumatoid arthritis include fatigue, anorexia, weight loss, and generalized stiffness, which may precede the onset of joint symptoms. Other symptoms include tender, warm, swollen joints and joint stiffness that is usually worse in the mornings and after inactivity. Early rheumatoid arthritis usually affects the smaller joints first, such as the joints between the fingers and hands and the toes and feet. As the disease progresses, symptoms often spread to the wrist, knees, ankles, elbows, hips, and shoulders. Typically, symptoms occur in the same joints on both sides of the body. The interprofessional care that should be provided for patients with rheumatoid arthritis should include individual treatment plan that considers the patient's disease activity, joint function, age, sex, family and social roles, and response to previous treatment. The interprofessional healthcare team should also provide a caring, long-term relationship with the patient to promote the patient's self-esteem and positive coping. The healthcare team can help the patient manage their rheumatoid arthritis through various means, including nutritional and weight management education, therapeutic exercise, psychological support, rest and joint protection, and heat and cold applications. There is no cure for rheumatoid arthritis, but symptoms can be treated with various medications, therapy, and surgery. Medications used to treat rheumatoid arthritis include disease-modifying anti-rheumatic drugs, also known as DMARDs, biologic response modifiers, NSAIDs, and intra-articular or systemic corticosteroids. Treatment therapy may also include physical, occupational, or nutritional therapy. Surgery is another treatment option which can help improve the function of severely deformed joints and relieve severe pain. Surgical procedures that can help treat rheumatoid arthritis include synovectomy, tendon repair, joint fusion, and total joint replacement. Developing a plan of care using the nursing process is important. For example, a nursing diagnosis for a patient with rheumatoid arthritis could include chronic pain related to joint inflammation secondary to rheumatoid arthritis, as evidenced by a pain rating of 9 out of 10, guarding sign on their affected fingers, restlessness, and irritability. Desired outcomes for this nursing diagnosis would include patients stating a pain rating of 3 or less out of 10 on the pain scale, and positive mood changes within 8 hours. Nursing interventions include administering the prescribed pain medications and medications for rheumatoid arthritis, checking the patient's vital signs, encouraging the patient to do first lip breathing and deep breathing exercises, and repositioning the patient into a comfortable position. Evaluation of nursing intervention should be done at specific intervals to determine its effectiveness. Asking the patient to rate their pain after 30 minutes to 1 hour after administering pain medication is necessary. Nursing interventions are successful when the patient reports their pain as a 3 out of 10 on the pain scale, and the patient states that she is comfortable and in an agreeable mood. Patient teaching should also be done before discharge and should include the disease process and home management strategies. The nurse should educate the patient on each prescribed drug and their action and side effects, and also help the patient develop a drug regimen. Fibromyalgia is another common musculoskeletal problem that affects more than 3 million people in the United States, especially women ages 40 to 75 years. It is a chronic central pain syndrome marked by widespread non-articular musculoskeletal pain and fatigue with multiple tender points. The pathophysiology of fibromyalgia involves abnormal central processing of nociceptive pain input due to various factors including increased levels of substance P in the spinal fluid, low blood flow to the thalamus, dysfunction of the hypothalamic pituitary adrenal axis, low serotonin and tryptophan levels, and abnormal cytokine function. A definitive diagnosis of fibromyalgia is often difficult to establish due to lack of knowledge of the disease and its manifestations among healthcare providers. Laboratory tests such as complete blood count, rheumatoid factor, thyroid function tests, and anti-nuclear antibody can help rule out other conditions that may have similar symptoms. Healthcare providers may utilize guidelines from the American College of Rheumatology to help diagnose fibromyalgia, which classifies a person as having fibromyalgia if they have widespread pain throughout their body for at least 3 months and pain is experienced in 11 of the 18 tender points, which is shown in this picture, upon palpation. Clinical manifestations of fibromyalgia may include widespread pain throughout the body, meaning that the pain occurs on both sides of the body and above and below the waist. Fatigue, cognitive difficulties impairing one's ability to focus, pay attention, and concentrate on mental tasks, irritable bowel syndrome with constipation and or diarrhea, abdominal pain and bloating, and difficulty swallowing. Interprofessional care that should be provided for patients with fibromyalgia includes consistent support from the interprofessional healthcare team due to the chronic nature of fibromyalgia. The healthcare team should also encourage and motivate the patient to be an active participant in their treatment. The patient should also be educated on the disease process, medications they are prescribed, other pharmacological and non-pharmacological treatments, and lifestyle modifications that may help relieve symptoms of fibromyalgia. Lifestyle modifications may include participating in low-impact aerobic exercises, such as walking, limiting intake of sugar, caffeine, and alcohol, and taking vitamin and mineral supplements approved by the healthcare provider. Treatment of fibromyalgia may involve various medications including pregabalin, such as Lyrica, duloxetine, like Cymbalta, and milnacipran. It may also include low-dose tricyclic antidepressants, selective serotonin reuptake inhibitors, or benzodiazepines. Long-acting opioids are not recommended unless other therapies are not successful. In some patients, pain may be managed with over-the-counter analgesics such as acetaminophen, ibuprofen, and naproxen. Non-opioids such as tramadol may also be used. Non-pharmacological treatment may include massage combined with ultrasound, use of alternating heat and cold packs, and relaxation strategies such as medication, imagery, biofeedback, and cognitive behavioral therapy. Patients with fibromyalgia also need therapy including physical therapy, occupational therapy, and counseling. They may also benefit from complementary therapy such as acupuncture, chiropractic, and hypnosis. When caring for a patient with fibromyalgia, A nursing diagnosis may include inferred physical mobility related to discomfort and pain secondary to fibromyalgia, as evidenced by an ability to perform activities of daily living. A desired outcome for this nursing diagnosis would be that the patient will increase strength and function of the affected body part and experience low to no pain after 5 days of nursing interventions. Nursing interventions include assisting the patient with active or passive range of motion exercises, repositioning the patient frequently, assisting the patient with activities of daily living, then encouraging the patient to do these activities independently, and administering prescribed pain medications. After 5 days of nursing interventions, evaluation of the care plan is performed, and it should be found that the patient is able to increase strength and function of the affected body part and report their pain as a 1 out of 10 on the pain scale. Those are 2 common musculoskeletal problems. Thank you for watching my presentation.